Think about it, in the United States, 9 out
Wow.
of 10 people are healthy literate. That means their outcomes are poor. I unfortunately lost both my parents to cancer. And then worst of all, which is obviously my parents became that stat, is 25%
Mhm.
increase in death. He had colon cancer and he had struggled for many years. Kind of knew something was off. She developed breast cancer. This is where it ignited for me. The journey that she went through originated from the moment she was diagnosed, educating patients on their health journey and then taking that information and making informed decisions on their health. And unfortunately, my mother didn't really speak English well. She just kind of let the doctor take control of everything. But I am pro empowerment of patients. I started creating Health Quest. So the website is healthquest-gaming.com. I'm a gamer, so I always knew I wanted to marry medicine and gaming. And chronic diseases impact someone. My platform with my company is for doctors to empower them, to empower patients. Understanding where that patient is in their journey. Do they understand what breast cancer means? Those questions weren't asked. Not efficient, especially when you have chronic diseases and lifelong changes like that. Spend the patient time to digest and then produce information and a decision that they want, that they think is best. They reveal to the doctor exactly where the patient is in their journey. That enhanced communication between the patient and the doctor, giving the options to the patient to choose whatever works for them. So map out our platform experience. The patient and the doctor are overlapping, a cloud-based platform to give the accessibility to everyone. We are replacing brochures. The archaic
Aha.
system of brochures and paperwork, people have shifted to gamification. And the doctor prescribes a game as simple as playing them on the potty or playing them on in the doctor's office while you're waiting. It sends that data to the doctor. The patient can see it as well. Doctor then gets a grid and sees, okay, here are the areas that Zena is struggling in, and based on her electronic health records, here are the areas that are needing of support, and here are the areas that she's good at. AI to generate insights for the doctor. Now the doctor and patient meet. They know exactly what those points were.
Mhm.
They have that conversation. Doctor talks to them, and then the care is in hand. More communication with patients actually increases outcomes. Patients that are health literate that have heart conditions, if they come out of the hospital, they have a 30% increased chance of death. Platform is free for patients. It's the doctor side that we figure out how to pay for the patient. I
Aha.
That is like another pillar of ours. Never charge the patients. They should not be charged for this. Move those barriers from the patient and the doctors.
It all comes to play
All
here.
comes, yeah. We focus on chronic diseases right now. Do older people play games? And I said, absolutely, they play games. When your kind of behavioral psychology is very effective for patient, and there's better positive outcomes for the patient. Focus on diabetes as our launch. It's remarkable how much money goes into diabetes, and the numbers
Mm.
just keep getting worse every year. And our games will make an impact, but then you think about the comorbidities, and this is for all the chronic disease. So we do have cancer, have eczema, GI. That's the power of our platform. Give insights to the doctor that they would otherwise never be able to see, which we're pioneering.
It's a physician, a better physician.
Yeah.
Well, hello. Welcome to the next episode of IPZO Facto. I am so thrilled today to have with me Dr. Carlos Garcia. Carlos is a really good friend of mine. We met years ago while working in R&D, and he is a founder of a new startup, which I think you'll really find really interesting to hear about his origin story and the whys and the purpose behind that. And so I'm really excited, Carlos, to have you on the stage here with me today. And if you could start out by letting the audience know a little bit about you and your origin story.
Yeah, sure. Thank you, Zena. Thanks for having me here. It has come full circle since I had you on my podcast many years ago,
That's
which was a
right.
lot of fun. But yeah, so I'm Carlos Garcia. Um, I mean, if we're gonna go far back on my origin story, I've loved science since I was a little kid. And then fast forward, I did my PhD, and I knew from then on, the moment I started my PhD, without any context, that I did not want to do academia. And I didn't know what that looked like. I had absolutely no idea what other things I could do until I joined a couple programs at Rutgers that introduced me to other things. And that's how I got into medical marketing. So this is kind of like the
Right.
pathway that led me to where we met eventually. So during that, that was a lot of fun, being on the flip side of things, of those annoying commercials that people see on during Hulu ads or whatever. Unfortunately, I was taking part in those ads. Maybe not the copy that what they're saying, but the medical material. So it was a lot of fun. But then my career skyrocketed once I took part in the COVID vaccines. So helping with the medical content and leading them for two of them, which was extraordinary. So I do have a background in infectious diseases and biomedicine. So that really, really helped as
Mm,
well. So that was a lot of fun. And then eventually my career kept getting better in terms of opportunities that places had for me and bosses I had. But I realized I had a niche for digital health. Another thing that I wasn't really fully grasping at the time, but it was a lot of fun. And once I did a couple, I ended up winning a medical marketing award
uh-huh.
that medical people never win because it's always the marketing people or the copy people or somebody else. The medical people never get any recognition, but I did, and that's how I knew I had a gift on this area. So then I started working on that, and then eventually, this is how I met you because I had interned at GSK Haleon, and that person brought me back, Richard. And then from then on, I joined Haleon and met you very, very quickly because you were my counterpart on the brand. Um, and uh, and then in between there, before all this happened, so my founder story starts way back to all this. So I unfortunately lost both my parents to cancers. So my father,
Mm,
I lost to cancer when I was 20, so my junior year of college. And he had colon cancer and he had struggled for many years. But Fortunately, he passed from that. And then I kind of knew something was off from then on, that it's just weird that people didn't readily die from colon cancer. Yes, he was probably stubborn and didn't help for certain things, but his journey
mm,
felt odd to me. And as an adult, and having a lot of medical knowledge, now I know there was. I helped raise my siblings at then with my mom, but unfortunately, years later, she developed breast cancer. And
mm.
this is where the journey really ignited for me because I was a lot older and I was, in graduate school. So she passed away the day after I defended my PhD. So she got to see me
Oh,
defend.
wow.
I
Oh,
got my PhD, but unfortunately, the next day she passed. So she died. A complication from breast cancer, which is a pulmonary embolism. And
mm,
when I found out about that, I looked more into it and I realized that all this pathway, that this journey that she went through, originated from the moment she was diagnosed to her kind of what we call health literacy. At everybody understands health literacy, but at the company, what I've developed is educating patients on their health journey and then taking that information and making informed decisions on their health. And unfortunately, one, my mother didn't really speak English well or understand it as much. And two, she just kind of let the doctor take control of everything. Doctors is not just one. And nothing against doctors, but I really am pro empowerment of patients. um, they My mother wanted both breasts removed, and so did I. And she asked me about it. I looked into it, and I was like, that makes total sense based on what she had. And they ended up just removing one, and they really kind of forced her into that. And I knew there was going to be something that was going to happen down the line. I didn't know what it was, but
mhm.
something did. So 3 years later, that's what she died of a pulmonary embolism that killed her instantly because of the breast cancer that was left behind on the other breast. So it was
Ah,
forming and they had missed it. And unfortunately, this is what happened. That's when it really triggered in me that at the time I didn't know the word health literacy, but I knew that health education was really important to me. And that's when I started creating Health Quest from then on. So I ended up adopting my siblings. They started living with me with my own biological children, and throughout that time, in between, from marketing all the way to Haleon, I had been developing this company little by little. I didn't know what it looked like. I still needed some of the tools. I'm a gamer, and so I play a lot of video games. So I always knew I wanted to marry medicine and gaming. And one thing I was just telling my one of my friends is when I was younger, there's some games I could not beat, and it was just I was too kiddish. I couldn't, like Mario, Zelda, whatever. and then I would wait like a little bit later to basically get older and smarter and then beat it, and that would be good. So I took that learning and did it for my own education of how to start this company. And then eventually I got it all together and I started Health Quest. And it's deeply inspired by my founder story. The people that have joined my team as well are deeply involved based on their stories as well. Health
Mm.
literacy or health education, especially like cancers and chronic diseases, almost always impact someone. Everybody can resonate with this. And I think that's really important because when we start seeing how powerful health education works on patients and even kids, because we focus on kids as well, this is what motivates me and
Mm.
helps me, keep moving forward and developing the things that we do at Health Quest. That was sorry, that was really long, but that was full
No,
circle.
it's yeah, absolutely. I think the context story is important, right? There's the story itself, and then there's the environment and the context. And I'm a strong believer everything happens in a moment and at a time, and you just try to kind of make sense of it and make some connections. And it's people who have strength like you to take difficult situations and challenges to see, rather than sitting in despair, but
Hmm.
okay, how can I take this experience and make sure you help others so that they don't go through the same thing? How can we make
Exactly.
it better?
Yep. Exactly.
And so, first of all, I'm so sorry you know everything losing your parents is always difficult, and taking that broader responsibility for your family, and adopting your siblings, and that's a a big challenge to take on, but it's all keeping the family together, and that
Hmm.
continuity which you took on so admirably. And
Thank you.
so, talking about your mom's experience, I mean, it's interesting. Um, Her preference, it sounds like, if I heard you correctly, was to get both breasts removed.
Hmm.
But that didn't happen. So as you look back, um, do you think do you think and your I want to just narrow down on the on health literacy
Hmm.
aspect that you talked about here, particularly with this story. Let me put it this way. Knowing what you know now, how do you think that situation with your mom uh, could have been influenced or improved, such that what gap was there that
Hmm.
what your mom wanted, it seems, didn't
Hmm.
actually happen? So what actually was that gap? And if you went back to the same age you were then, back to that time, knowing what you know now, what would be different to
Yeah,
have a different outcome?
that's an excellent question. So when you look at these patient journeys, like specifically my mom, um, what happened back then was basically you have this patient who may not speak English well, may or may not, it doesn't matter in either case, but telling the doctor they want something, right? And they were told by their friends, they saw it on the internet. Um, all those things bother doctors, and from the beginning of the internet, probably all the way to now with AI. The doctor obviously knows best. They're medically trained. They have an insane amount of debt coming out of medical school. Why would a patient that has no medical context Google something and then tell them what to do? That's basically how that was taken. Is
Hmm.
why this uneducated woman is telling me that she wants both breast movement when I'm telling her it's for her best interest based on what I know that this is happening. And again, I'm not faulting anytime, any
Right.
place the doctors because my platform with my company is for doctors, to empower them to empower patients as well. So but these situations, the patient should have been heard a little better. But then giving that rationale is like understanding where that patient is in their journey.
Yeah.
So do they understand what breast cancer means? Do they know what, BRCA positive, BRCA negative? Do they know what removing both breasts means and the downstream effects? And, you know, those questions weren't asked, right? They're just like, no, you're wrong.
Mhm.
We're going to do it this way instead. So, that's not efficient, especially when you have chronic diseases and lifelong changes like that, especially for women when, this is a life-changing, altering thing that's happening to them. So I think looking back, and if I put myself in that situation, it'd be around, okay, let's organize our thoughts, understand all the information that we have, which sometimes is very difficult as well. You have like the lab
Mm.
results, you have probably like five different doctors giving different, outputs, whatever. But organizing, giving the patient time to digest and understand, and then produce information and a decision that they want, that they think is best, that maybe sometimes contrary to the doctor, but the doctor still should talk to them and be like, well, here's the pros and cons of this situation. Here are the pros and cons of the situation, which again doesn't always happen because unfortunately the doctors have another cancer patient waiting for them in the other room that's been sitting there for an hour. So now I have to hurry up with you. So that's a whole level of
Yeah.
issues that come about. But it just comes down to that education, having time to be formally educated to make an informed decision, which is all around health literacy.
And so, if I understand correctly, what you're really doing is empowering the patient to have that conversation, that dialogue, and we'll get into your solution that you're looking for. But it seems like the problem that you're trying to solve is to enable that dialogue.
Correct. Yeah. And so, I can go into the platform when we want to talk about it, but
Yeah.
essentially we reveal to the doctor exactly where the patient is in their journey. So understanding, like, do they understand what breast cancer is? Do they know
Hmm.
how this, what double mastectomy or a single one works? Do they understand like this chemotherapy? So the doctor now knows, you know, Soul, which was my mother's name, knows and understands based on this output that I received. Now I feel more comfortable that she didn't just go to an AI software or Google things. And now I can have that conversation comfortably because then I can fill in those gaps that she's missing. We're not trying to solve all of medicine. We're trying to have that enhanced communication between the patient and the doctor. The patient themselves also feel empowered because now they feel educated. They feel like they're ready to have that
Right.
conversation, not suffer
Mhm.
from white coat syndrome when they go to the doctor's office and they're like, I feel great, I'm fine, whatever you want, which is not always right for each patient. Each
Mm.
patient's different. Maybe when you're a child, the parents are making those decisions for you, but when you're an
Yeah.
adult, you feel like a kid again. You're like, well, whatever you want, doctor, but that may not be working for you. So giving yourself an understanding of where you are in your journey so that way you can talk to the doctor at a better level, really empowers the patients. This is the feedback we've been getting from patients and doctors.
Mm. Yeah, and I think just hovering around this origin story, right? I think is good because um, it really put any individual. See, uh, I was recently at a Farmageddon event, and one of the organizers really brought this quote in my mind, which I never forget. And healthcare is the one thing that binds us all, essentially, right? And, it's non-political, it's non I mean, everyone is engaged at some point in their life with the healthcare system. So, this is something that everyone will experience of having those health challenges and having these conversations. And I think for people to be educated on, you know, well, it's okay to ask questions, right? Sometimes,
Mhm.
people might feel they don't want to challenge the doctor or
Yeah.
and asking a question doesn't mean you're challenging the doctor, right? It's really having that dialogue and have being comfortable with asking those questions. And it benefits the treatment in the sense that, well, then the patient can be forewarned of what to be aware of,
Yeah.
if something is not going well enough, post-treatment or during treatment, to say, "Okay, I've been educated on, the pros and cons, and Some cons I heard about, and I'm not feeling quite right, but because I was educated about it, I'm gonna bring it up.
Yep. Yeah, exactly.
And so I want to touch on another thing in terms of your evolution in your career, where you mentioned digital health. I think you were really working in the digital environment before it
Mhm.
was a thing,
Yeah.
right before there was this name of digital health as such. And so that was part of really learning about communication as well, right? That this health literacy in that medical and marketing role that you had. Is there uh, a key surprise or some some memorable, learning that came to mind that you apply now through what you learned through all of that experience?
Yeah. So in marketing, there are more teams than people think. There is a medical person, there is a brand person, but then there's also like health literacy people. There's also an engagement strategist. There's a social media strategist. There's a digital There's all these type of people that I got to work with that really broadened my view of it's not just two people working together and executing. Um, uh, what I found, and it just remarkable how underutilized these type of people are, is engagement strategists. And what
Mm,
engagement strategists are is not just like the people figuring out how a user is interacting with the marketing materials or the ads or whatever. It's actually mapping out the journey that the marketing team is going to execute on, or the medical team or whatever. And every agency I had been going through, each of the engagement strategists were very different. They were all trained different. So to me, it felt like a new field, like people were just trying to figure out.
mm,
But it got better and better. I started realizing, oh, it's getting better and better. And so I met a particular person that just blew me away when I first saw their engagement strategy map for this launch drug. And it was like all the touch points that a patient would have in their journey leading to the drug, and then all the touch points the doctor's journey would touch around this drug, like the channels, so where they're going to put the ads or social media, what are they going to say, how they're going to bring, but then also how they overlap. And that graphic blew me away, and to this
mm,
day I don't do it as effectively as she does, but it blew me away. And when I look at it, I always think about these journeys when I work on different disease states. I think of it as a gamer. I call it a choose your own adventure. So basically, giving the options to the patient to choose whatever works for them. Most marketing company, metal marketing, they just force you in these decisions to pick their drug, which blows that upsets me, and it blows me away that we still do this. I instead flip the script and basically like, okay, I will give you the generic versions of the drugs, which makes us the ability to talk about them now through
mm,
unregulated space because it's education.
mhm.
And it's like whatever fits for you is what drug you get to choose. And she's taught me those skill sets to map out those journeys. So then that's how we also map out our platform experience. So that the patient and the doctor are overlapping. But I thought engagement maps are utterly fascinating. If you've never seen them, they drive the whole thing down for the medical team, brand team, medical marketing team, whomever. It's really cool. That is something that's always stuck to me since the moment I joined medical marketing.
Wow, that's fascinating. And I mean, it really is about engagement, right? If the user, whoever the user is, whether that's a doctor or patient or other type of caregiver, or a hospital system, if they're not engaged, then the benefit won't come through,
Mm-hmm.
right?
Exactly. Mm-hmm.
So yeah, let's talk about what your platform, or what you're developing. So
Sure.
given your origin story and the why that you were trying to solve, and all of this, how did you um think about think about what you're forming. And yeah, why don't we you tell us about your platform and what you're trying to solve for and what it looks like.
Yeah. Uh, so when I first started the idea, it was a choose your own adventure kind of thing. It's my favorite type of games. And I think it also broadened out the experiences for patients and doctors. But as I gain new skill sets every year and learn new things from looking at what companies were doing, medical companies or gaming companies, it started getting better, the formulation of the idea, until realized that it needed to be a cloud-based platform. And the reason why we chose that is to give the accessibility to everyone. That way, people don't have to, some underserved or underrepresented
Hmm.
people, patients, gamers may not have a PC, may not have like the smartest phone out there or whatever, but we increase the accessibility that way. So I knew that was a must. And then my CTO finally joined after months of looking for someone. They joined, and we started working together on the vision of the platform. And I basically brought all my ideas, had it all laid out. I had already been pitching before he joined, but we didn't have an actual product because I was missing a CTO. But he really liked the vision, and essentially, it's a platform. It's two-sided. So there's a patient side and a HCP side, so the doctor side. The doctor essentially prescribes our games to educate the patients. So the
Hmm.
games could be for diabetes, it could be for cancer, it could be for whatever it is. They send out those games to the patient, and the patient plays it. So just think about it like we are replacing brochures, that archaic
Aha.
system of brochures and paperwork that you get, and the moment that you leave, you're probably throwing it out, or you're forgetting that you have it because they give you a folder with 30 other ones. Like,
Yeah.
I'm definitely an N of one in terms of nerdism because I will read all through that. And when my daughter was born prematurely, we had all these NICU stuff, like a folder like this thick. I went through it all, but I was thinking like, and this is why I was creating Health Quest. Like,
Huh.
do people actually read this? They go home, especially new parents. I mean, this was our second child, but new parents, they're probably freaking out. But these doctors are giving them these folders that are so thick with information, and that's not how everybody reads now. Like, how often do you see people reading through any article? They
Yeah.
probably just read the header, the sub, and then the maybe look at the pictures, and then that's it. It's really the engagement of that experience is different, but people have shifted to gamification. So how much
Hmm.
people actually value getting rewarded for something. Look at like all
Hmm.
these different software apps that you could put on your computer or on your phone where you do something and they reward you. So like, play games, we'll pay for you. Go use these coupons, we'll pay for you. Like all this stuff. That's gamification. Even on your watches, there's gamification. So so we started looking at these things and these concepts. So then the doctor prescribes a game, patients play it. While they're playing, we have a proprietary system running in the back end that combines gaming and healthcare data together. And then it sends that data to the doctor. The patient can see it as well. The doctor then gets a grid and sees, okay, here are the areas that Xena is struggling in the game and in real life. And based on the, her electronic health records, here are the
Hmm.
areas that are needing of support, and here are the areas that she's good at. Then we use our AI to generate insights for the doctor, kind of know which ones he or she should focus on, and then they get that right. And then the patient side, similar, we kind of show you where you need to work on it. We give you patient insight, so it's not heavy medical. It's just like, let's say it's A1C or
Mhm.
something around mental health or weight loss. The AI will just give you insights based on our own data and be like, hey, maybe you should take more walks. You're doing a great job. You did a great job. Maybe, January 1st, unfortunately, January 4th, hey, like, little fun facts, like talk to them like a person.
Right.
And then the patient then will respond to it, especially it's gamified. So they get rewarded for these things. Now the doctor and patient meet, they know exactly what those points were.
Mhm.
They have that conversation, doctor talks to them, and then the care is enhanced. There's better outcomes. It's always been shown before gaming like this has been introduced in gamification, is communication with the patients, or more communication with the patients, actually increases outcomes because the patient is
Mhm.
educated. When you look at patient outcomes where um, 88% or 9 out of 10, the new stats, 9 out of 10 patients are healthy literate. That's an insane number to think about in the United States. 9 out
Wow.
of 10 people are healthy literate. That means their outcomes are poor, and it doesn't matter. Well, when you pull it further, then you look at economic statuses
Right.
that can change and actually skew things around. But overall, that's our society, which is really unfortunate. Those outcomes are going to be poor. They can have higher hospital visits. They can stay in the hospital longer because they're not improving because they're not taking their medication. They're not adherent.
Right.
And then worst of all, which is obviously my parents became that stat, is 25%
Mm.
increase in death. So when I tell people this, they're like, how does health literacy cause death? Well, imagine you have three medications and you have no
Mhm.
idea what they do, and you take one because you think they're all the same, but the other two are very vital because they work together, like blood pressure medication. That patient has an increased chance of heart attack. And patients actually that are health literate that have heart conditions, if they come out of the hospital, they have a 30% increased chance of death coming out of the hospital if they're cardiovascular patients that have issues, because it's so important to educate patients around their heart, because they're going to go back and do drinking, smoking, partying, maybe
Yeah.
eating unhealthy. So again, health literacy. So our platform is also given at that time where instead of giving you a brochure, it's like, hey, play this game and then have a follow-up visit. And then we can ping them also to, hey, play the game. The games are short formed. They're not like Roblox or Call of Duty or Fortnite, like these big, huge games. They are as simple as playing them on the potty or playing them on in the doctor's office while you're waiting. You get the
Okay.
information, it's quick and easy. We do have a gamification loop where you can play for a longer period of time if you want to, but we really want to hit home on the education, get them at the level what they want, and if they want more, they can always come back. The platform is free for patients. It's the doctor side that we figure out how to pay for the patients. I
Uh-huh.
that is like another pillar of ours. Never charge the patients. They should not be charged for this. Our
Wow.
insurance companies have plenty of money to pay for software like this. And so we figured out a way to do that so the patients are happy. We don't want to push this, even if it's $4.99 or $5 or $10, which patients said they would pay. I just think about my family, no way. That's
Hmm.
not sustainable.
Right, right.
Yes, you could sacrifice like Netflix or something, but what happens if you have kids? I have kids. I need Netflix sometimes because they're bad. So I need to give them a distraction for a little bit. I don't want to sacrifice Netflix for that. So we remove those barriers from the patient and the doctor so that it's a better decision. Just like it just makes sense. Let's just do it. Why not? So that's how we figured out. So all this is under all the strategy work that I've learned throughout my medical marketing experience.
It all comes to play
All
here.
comes, yeah, all of it.
All comes to play. Really, really interesting, and I think several of us, and me being part of this audience listening to you just now, I mean, a lot of this does resonate because I'm imagining myself getting when I've gotten brochures and stuff, and yeah, I do read them like you, but sometimes there's things that are not covered, and I have additional
Mhm.
questions, and I do end up going to Google, or I do end up, looking at Reddit or other groups of, other patients, going through something and try to get more information.
Yeah.
Looking on YouTube to see what are other doctors saying about such and such. But it could very well be I'm barking up the wrong tree, right? If
Mhm.
there's something specific about the condition that's not relevant to mine, right?
Mhm.
Then I might be getting maybe not the best information, or not targeted information. I might be scaring myself more.
Yeah.
Um, and usually what you see on boards is usually when people are in trouble, or they are, I wouldn't say complaining, but sharing a challenging experience. Uh, I think the bias is more on that side than sharing, hey, everything was solved and this is what I did.
Yeah.
Unless they are very engaged and that's part of their personal ethos to give back and share that information. So it can skew someone's frame of mind, right, on
Mhm.
what they're suffering from. And so I really like how you really this is really about patient first, I think, as people say,
Hmm.
patient first, and you are uh, keeping the patient in mind. It's really about the patient journey and then how they are communicating with their healthcare professionals. But you're, like you said, you're taking away the barriers from that engagement, right? Because if
Yep.
there's that barrier, then they're not going to engage, and then the outcomes don't come delivered, even if you have a really good platform that can deliver, but it's
Hmm.
not going to be accessed for whatever reasons, and those that barriers you're trying to bring down. So I think that's great. So really then this becomes a tool as part of that care.
Yes. Yep. Exactly. So we give it to the doctors and nurses as a part of their regular processes that they do. So instead of giving a brochure at the end of the visit, they give the health quest game. They go and they play it. Obviously, some of the times that a lot of the times patients are as a follow up, especially we focus on chronic diseases right now for obvious
Okay.
reasons. And they have to come back or they have to go get a blood test and they still have to come back. So we kind of tie into their journey already. And actually, one of the scoring systems that we put is adherence, which is really important play in healthcare. And if the patient doesn't play the game, their adherence scores go down. And they'll see that because the sign up between the patient and the doctor is really governed by us so that we can support that patient without them doing that extra effort. And the doctor, obviously. But we will ping them, be like, hey, your adherence scores are going down because you're not playing the game. And
Mm.
we have tied a lot of gamification and importantly behavioral psychology around these things. I use the perfect example is the FOMO effect, right? So,
Huh.
I mean, it happened to me and my friend over the weekend. We were in Canada, and we saw a line, and it was just like this object that we had no idea what it was. We just kept looking at it, like, what is that? And then the line got bigger, and we would stare at him. We don't know what it was, but we wanted to go on that line just because we wanted to see what it was. And I felt really FOMO, and FOMO originated from like crypto, like we were gonna miss out on buying some crypto. So we do FOMO psychological things for patients and doctors as well. So the FOMO effect for patients is, hey, I'm gonna miss out getting this better care or knowing that information that the doctor said for me to learn. And then there's also the kind of like that mentality that you're back at school, that your teacher is going to be upset that you didn't do your homework with the next time you come to school. So that's also the mentality is like, oh, great, the doctor's going to yell at me or say something. So they'll play it, right? And we make it easy for them because it's only like 5 to 15 minutes of game time. Um, they could do it in the waiting room, which is what we kind of talk to the doctors to, like, hey, just tell them do it in
Mm.
the waiting room. Why get upset patients when they're sitting there on their phones, like texting their friend, like, oh, I'm waiting an hour here, or they could play a
Yeah.
game that's actually going to enhance the care that they're about to get. So that's what we do as well. But yeah, so those are a couple like behavioral psychology things that we do. We have one of the world leader experts in gamification and behavioral psychology that joined our team very, very early on. He really believed in the product, so he helps us design these things that way and gives us those insights. He has a framework, and we really wanted to focus that we don't want to have gamification that's, I call it dirty. If you look at some
Mhm.
of the other games and gamification like Candy Crush, look, my one
Right.
of my
Yeah.
founders plays Candy Crush. I think it's a very interesting game, but it is hardcore psychological. Like it really gets in your
Yeah.
head. It makes you spend money. It has to do with the
Yeah, I mean,
colors and the
I've
sound.
seen people just in even people of my parents' age, right? It just, which
Exactly.
fascinates me. Just it's
Yep.
obsession, like hours and hours and hours and hours at a time. And I'm like, I don't get it because
I don't know.
I haven't, let myself, get into that. I guess where I really started hearing about things like that was with Angry Birds when that came out,
Mm,
years
yeah, that's a
ago,
good game. Yeah.
and Candy Crush then, I guess more recently, which is ubiquitous. I mean, everyone all over the world. So, okay,
Yeah.
so there's a reason why people are obsessed with it.
Yeah, and so those are a couple reasons. Um, when you look at the numbers, and you bring up a good point because I've been asked this all the time, is you're only targeting a certain group of patients because do older people play games? And I said, absolutely, they play games. When there was a survey that came out like 2 years ago that put it into the different categories, so millennials, Z, alpha, X, boomers, like all this stuff, right? And you see that people that at that time aged 59 and up, 45% to 60% were playing games. Now, the games could be Candy Crush, and that's fine. That's a game still. Or it could be there's like this YouTube channel which I think is so funny, but it's elderly people playing like Call of Duty or like a shooter game
Oh,
that you need a high coordination and reflexes to play, but it's just so
ah,
funny. So there are people that play, but most
yeah,
importantly, if you look at millennials, we're older now. And
yeah,
we
imagine.
started that generation of games, right? We
Well,
were
I'm not a
born into and raised
millennial,
by.
but yeah.
Yeah, well, I I I don't wanna assume, you
There
you,
you go.
uh, you look like a millennial,
Like
so I just
it.
assumed.
I'll take
So
that as a compliment.
obviously, yes. So, the millennials have always played games, but we're older, we're on medication, our kids, now we have kids, so they're, being helped.
Mhm.
And then the younger generation that everybody loves so much, the social media generation is they play a lot of games too. That's
Yeah,
because games are built into their like TikTok, Snapchat,
that's right.
Netflix, like it's already built into it. So it's just easy. So games are so easy to get into. And um, so that's how we utilize like the framework that my advisor uses. We bring it into that game field, but we don't use dirty tactics. We don't trick
Mm,
you. We use FOMO effect in the nicest way. It's like, well, do you want to not be the only one not knowing the information when you go into that doctor
right,
conversation?
right. Yeah,
So there's a site, but we also don't make you buy things in the game. So a lot of
mm,
games just have a lot of content in there that you just buy.
yeah,
There are people that spend the money, and unfortunately, I in some countries it's illegal to do like loot boxes or that it's basically gambling. But in this country, it's not. So you get them at a young age. Look at people that spend on Fortnite or Roblox, like parents,
yeah.
tens of thousands of dollars thrown away because their kids are just
Wow,
addicted to these things.
wow.
Um, so it's all psychological. It's that sensation, that dopamine hit of releasing that box. It opens up. You may or may not get the thing you want. Um, we tie all this together, not the loot box, but we tie all this together to white hat tactics that are good for the patients. It helps them. It doesn't impact their psychological, thinking already. We're not trying to, slap their hand, but hey, don't do that. We're
Yes.
more going with their journey and what works with them. And hey, some of these games may not work for patients, and maybe that's not the way they're think, but everybody thinks differently. So we try to engage them where they're at. And so far it's been working for us.
Wow. Yeah, amazing. So, I think, back in the day when I first started hearing about, when since we're friends, you were telling me about your what you were thinking and your ideas, and I think back then we were still kind of in the area of, well, this is something a little new. Are people really going to engage with something like this? That might have been some of the feedback you were getting as well. I don't recall, but certainly at the time I heard you talking about this when it was an idea stage. It did seem at that time, and that was several years ago. But now, when you think about it, things have shifted so quickly
Yep.
in our lives and in terms of technology. And now, this would just be I mean, we're talking about back in the day when digital health was a separate thing, right? And
Hmm.
now it's just part of healthcare. Nobody really
Yeah.
should be thinking about digital health apart from health, right?
Hmm.
It's the way you do things like digital marketing. It used to be a separate thing, digital marketing. Now, why it's just part of marketing.
Yeah.
Why would you separate and call something digital marketing? And I think like the Gen Zers and everyone else. And yes, people my parents' age are also getting into gaming. And my mom actually is a I'm so impressed. She's really good at texting. She just gets into the really short um, snippets, and she uses abbreviations and all of that. I'm going, how did she learn that? I have no idea. But people adapt and learn very
Yeah.
quickly. And I think we shouldn't assume that people who are older don't want to be involved.
That's a good point.
They still want to be involved, and there's that desire for that social connection, um, and especially when you're older, or even when you're younger and you're educated about health and what you can do to improve your health. There's all these points of engagement, right?
Yeah.
And so you mentioned about the positive aspects here that you're targeting in terms of the gaming. And I think having the offering of this as part of a treatment or part of care, um, and being accessible to the patient, means that that's taking one barrier away. That anyone, no matter what their socioeconomic class, would possibly have access to this, right?
Hmm.
And so that's one barrier taken away. I
Yep.
guess the other barrier would be from the engagement, like the first uh, impression of just the idea of it. Oh, I'm going to go through something and it's going to slap my hand and tell me you're not doing this good enough, or you didn't pay attention. You need to, wag the finger at me digitally, or, some sort of aspect to that effect.
Yeah.
But you mentioned a couple of words. You mentioned white hat, I believe.
Hmm.
And then also you mentioned, gamification in a positive way. And you
Hmm.
mentioned dirty. So could you just clarify what you mean by those,
Yeah.
and maybe not, no need to go into deep detail, but how, what's how do you make it um, positively engaging? Because of course, I think people would probably be turned off if something tells me I'm not doing this good enough. They might
Hmm.
just quit. So how do you positively engage education
Yeah.
in someone's care?
So one of my backgrounds is I was a teacher for several years. I
Ah.
taught one of the hardest grades that you could teach is the pubescent ages, which is 7th to 12th. Okay. That was I feel bad for myself when I was a kid and what I did, but that was hard. And what I thank God about that experience is because it taught me that yes, these are not the patients per se that I might be working with, but these are the people. If I can talk to them and educate them in a way that they get it when they don't even want to be educated, they just want to be outside doing, playing or being at home sleeping, then I think I'm doing something good, right? And so I took those learnings into also creating the content that we do. Now, in
Aha.
terms of so that's one advantage that we have. The other is the gamification aspect. So think about it like this. Let's say I give you a game and well, the doctor gives you the game and says, Zena, you have diabetes. I need you to play this game end to end. This is a company, just play it. And you start playing it and you're really engaged with it. And all of a sudden, there's to find out more about the A1C component of your disease, you have to pay me $2. Oh, that's interesting. Okay, I guess it's just $2. All right, let me pay $2. Now you unlock that part of the game that's for $2 around A1C. So you start playing it, and then boom, you want to learn more about the different treatment options, $3. Well, that's weird. So you keep doing that. You keep doing it. Every time you want to learn more, there's a new paywall. That's how current
Mm,
games are. That's the
okay.
unfortunate, and that's what I call
Right.
dirty. Um, that is not a tactic you should do to anyone, let alone patients. They're already stressed about money, probably, but they're
Mm.
also stressed about what they're going through. So stopping their flow because you want to charge them for something is extremely inappropriate. for patients. And sometimes they will pay it because, hey, the doctor told me to do this. I know there are studies that show for recommending products or recommending anything to a patient, if that doctor or pharmacist or nurse or whoever it is a person in healthcare that gives you that recommendation, there's a 90% chance they will buy or do that thing because it
Mm,
was recommended by healthcare because they're so trusted, right? And so if I, as a doctor, told you to play it and I trust you, I'm going to keep buying these. So that's the dirty stuff. And unfortunately, that's what games do, like Candy Crush. So
yeah.
you want to get to level 1000 and you keep dying. Hey, if you give me $5, I'll give you a couple more hearts and you can try again. And then we have the white hat stuff, which is basically helping the patients feel good about what they're doing and succeeding without the barriers in place. So, putting an earnable way for them to do so. In our games, we use white hat. So essentially, instead of buying tokens to go move forward in the game or getting cosmetics or that new level, you can earn them by playing the game naturally. So we make it in a way that you can earn the tokens by just progressing and doing well in your health. And then you get the money to buy maybe a pet, buy a new part of your house, buy that rug you've been eyeing in the game, all these things. And then it feels great. You get that dopamine hit, you feel successful because you hustled on in the game and you got it. That kind of behavioral psychology is very effective for patient, and there's better positive outcomes for the patient because they don't feel that negativity behind of like, slap my hand, but I slapped your hand, but for $2 more I will stop slapping your hand and let you keep going. That's disgusting, and I hate games
Yeah.
that do that. The final point that I forgot to mention on all this on the gamification is we focus on a subtype of games called cozy. There are
Mm.
this word is widely used now. When first started playing these type of games, it was unacceptable for many reasons, and one of them is like the context of it is like, ooh, you're playing like a little kid's game, because some of the games that were cozy were like Hello Kitty or like Disney or
Oh,
like little like kids games, but they weren't designed that way. So cozy is exactly what it sounds like. You could just chill and play the game. There's no stress levels to your brain. There's no grinding. You don't have to be like this
okay.
playing video games wearing these type of headphones, you know. And so we focus on cozy to relax the patient so that that stress level goes down when they're in that environment. So our games are also designed to relax, the colors, the sounds, the
Mm,
gameplay. That's cozy. And that's another tactic we use in our games. Now, it doesn't mean all our games are cozy. It's definitely not the case. Some of our other games that we're acquiring right now, we're speaking to different game studios to work with us, to partner with us to add their games to our platform. We currently have 5 in the pipeline, and their games are not cozy. There's they're definitely different. One's like more like a temple run. Another one's more not cozy but more active strategy. So one's a puzzler. So they're all different, but I tell them the only reason why we're targeting them is because they feel relaxing to a patient. We ask the
mhm,
patients like, "Hey, would you play a game like this?" This not playing it exactly, but the look and feel. Does it feel like inviting to you? And they told us
got
yes.
it.
So we felt empowered to go after these games.
And so then I guess, but yeah, so let's talk about your platform a little further and
Sure.
your pipeline as such, and also the name of the because you know there in terms of this audience, it could be healthcare professionals out there as well.
Mhm.
Um, so the name of your platform, or how would people come to know about it, or what's the best way to connect with you? And then also in terms of you mentioned chronic disease focus, so maybe talk about where you're starting so people can reach out to you in those areas, and also what you have in mind for the pipeline. And look, sounds like some of the games you're acquiring is to be then used to modify or for other options.
Yeah,
If I've understood that correctly.
absolutely. You're absolutely right. So the website is healthquest-gaming.com. And that is the actual platform. So if you reach out on the website to us, then we can give you private access to the back end, which it reveals the actual platform experience, so the patient side, doctor side in the game. But other than that, you can see the platform. You can see how it works on any device. So in terms of that, um, so the platform experience is unified across any kind of system that we put in place. So we make sure that work looking back into any type of like healthcare system, it's easily to able to be plugged into our system. So we don't actually connect to EHR systems. We obviously, with my highly technical CTO, that was like a big caveat is which I obviously as a tech person, I kind of got it, but until he explained it further, I was like, oh, that actually makes sense. Like, let's protect us, the patients, and the doctor, so we don't actually
Mm,
connect with anybody. We have a proprietary way of connecting to the system in such a way that we still
okay.
can get that information without knowing the patients, who the patients are, obviously to protect their identity, HIPAA. Uh, the,
So, in terms of, yeah, the what the platform is, and then also you're focused on chronic
oh
disease, I
yes,
think you mentioned, so you could talk about that, and then further, pipeline ideas
sure.
you were mentioning.
So the chronic disease, so right now we focus on diabetes as our launch. We decided to focus on diabetes because of the landscape, and it's remarkable how much money goes into diabetes and the numbers
Mm,
just keep getting worse every year. I've been working on this startup for almost 2 years now, and from year 1 to now, it's just it's just unreal. It just blows my mind how much money he's put in, and it's just getting worse. I almost feel like the money is to make it worse because that's what it looks like. So, not
mm.
I think that the platform and our games will make an impact on diabetes because when we reached out
So
to
let's just pause there a minute. You
yeah.
said it's getting worse. What in what way are you,
Yeah.
commenting on that? Just maybe
Yeah. So,
double
when you
click there.
Yeah, when you look at the diabetes as a whole, so how many people are diagnosed with diabetes, it's substantially increasing.
Mhm.
We have in our platform right now, we have an algorithm that, depending on where your zip code is, it generates the current stats of your state. And when you look
Oh.
at, so if it's New Jersey, Texas, Florida, Washington, wherever, it will generate how many people are currently have diabetes and how much is being spent on diabetes by a patient and how much is being the grants and financial support around diabetes. These numbers are in the
Mhm.
billions for state like
Wow.
large states like New Jersey, Texas, New York, obviously in the millions in the smaller states, but it just keeps getting worse. We've been tracking this for now 2 years. And when you think about diabetes, it's just like diabetes, but then you think about the comorbidities that are associated. So the diseases that come from diabetes as well that get
Mm,
exacerbated because of it, eye issues, foot issues, mental health is a huge play, which we learned talking to patients. Um, and so that's why it's getting worse. And I'm sure that people are thinking like, what about Ozempic? What about all those stuff? Well, that's because you don't really truly understand how those work then, because if you give a patient Ozempic, which was originally for type 2 diabetes, the
mhm,
way those drugs work is it's very short-lived. That's why these patients have to stay on these products for the rest of their life. They can't just stop taking Ozempic. If not, they'll get all the weight loss, they'll look good for the summer, but then they get all that weight back. They're going to look a little bit different. I think it's like Ozempic eyes or bags or whatever it's called. All these issues with those type of drugs. So losing weight so abruptly and not naturally, you get all these issues, which leads to complications around diabetes still, because
mm,
your body has been forced to do something, and then it's good, but then all of a sudden you go back to eating and being normal, so now it's spiking it again. So it's making it worse, right? You're forcing the body to do something that it wasn't originally intended to do.
mm,
So that's why diabetes is getting worse. And this is also why we focus on diabetes because we don't foresee, based on our projections, that diabetes will improve that quickly, even if
yeah,
everybody's on Ozempic of some sort. There are natural products that are in the pipeline. There's alternatives to GLP-1s that are in the pipeline. They're current in the market, but as a whole, the United States is overweight. We
Yeah,
have terrible diets. We have a lot of sugar in our foods. So until we fix, I mean, I'm not getting into that type of thing, but until we fix those
right,
issues, you can't really fix diabetes as a whole, but you can educate patients so that they
right.
understand what to eat properly, how to navigate nutrition, why weight loss is important, when you should start seeing, the doctor for, pre-treatment for diabetes or for post-diabetes, why the Ozempic works for you and maybe Monjaro doesn't, or some other alternative like metformin,
Mm.
like, but that's what we're trying to do. So that's why we focused on diabetes. And this is for all the chronic disease. So we do have cancer, we do have eczema, we have GI. So our GI game is actually a lot of fun. I think all our games are fun. But our interns actually created the GI game, and it
Oh,
touches on, I know, it was remarkable. I could not believe what they created. Um, so that game is, it flips the script and you are the doctor and the
oh,
patient's the
wow.
doctor, and then you have to diagnose a patient based on like using the Bristol stool chart, looking at pictures of poop, and seeing, and then we took it a step further and be like, okay, great. So now if somebody knows to recognize what kind of poop they have, do they have Crohn's, do they have, some type of microbiome issue,
Ah,
dysphoria,
right,
do they have
right.
just irritable bowel syndrome, something. But then to take it a step further, this is our educational and gamification system is, well, what if we added a puzzler in that game where you knew how to give that person the proper diet to help them manage their GI
Uh-huh,
disorders? So
right.
so they took it a step further. I didn't do that. I just told them focus on GI, and they did that. So it was remarkable. And they did that. So that's like kind of another way we educate patients. So the GI game is in there. GI is very uncomfortable. It's also embarrassing.
Yeah.
So we wanted to focus on patients also on that realm.
I
Um,
don't know if it's increased prevalence or just more people talking about it or more specific diagnosis versus increase in prevalence, but I hear more and more people saying that they have Crohn's,
hmm,
um, uh, 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 or other type of, irritable bowel
yeah,
issues, um, which I didn't hear as much before. Suddenly there seems to be more of that.
yeah,
And it is very, for some people, it's very debilitating. I mean,
yeah,
their lifestyles are really hindered quite a bit. And so I think this is interesting where you say the interns, worked on this, and this was a part of a comment I was going to make earlier, uh, in terms of how you develop this tool, this gamification digital tool, education tool for patients
hmm,
to engage. And this is something that I think is, if it's not already going there, very soon is going to be the primary way people are educated,
yeah,
or the primary way people are uh, getting knowledge, and it's already happening, right, through digital. But what you're flipping up is through in within the healthcare system doing this, that aligns then with the current society is already there, right?
yeah,
And so if you're having, interns coming up with these ideas, that's indicative of where we are in society, right?
yeah,
What people will expect, like, younger millennials and Gen Zers are going, what the heck is this you're giving me? They would
yeah,
demand
they
more
are.
because they know more, right? And so they're saying
Exactly.
this is unacceptable. Doc, what's going on here? You're not actually answering my questions. I think they're a lot more empowered, and they're also growing up in the digital realm and learning how to speak, right? It
Yeah,
comes natural to speak on video and to challenge questions, and also a lot more activism and taking control, because I think, um, especially Gen Zers and younger are, and the way technology is advancing so quickly, the lives of my parents was probably not dramatically different than the life I had, right? But now the younger generations is completely different than that of my parents, right? And so you're having 100 years of, or if not more, advancement in how people live in a very short lifespan. So it could be 10 years, right? 10 years from now, it could be hundreds of years worth of evolution we normally would have. So I think engaging with patients in this way and in care is actually expected. It will be expected, and so I think it's great that you're bringing this forward. And already at the same time, you're also not staying stagnant. You're also, advancing on what you're providing. So I think that's really fascinating, and it just says further what the potential is here.
Yeah. When we just recently did a workshop at a university around what we do at HealthQuest, and basically educated them on health literacy and things like that, which they weren't. They didn't know what the word was, but they knew what the context was. So it shows again that they understand. And when I told them about what we do on our platform, and basically like one of the students actually scared me because I thought she was going to say something else, but I told them like, what if, her example was that she had a headache, she went to the doctor, and I was like, okay, using your example, the doctor sends you health quest because you have a headache, but he doesn't know, so he gives you the one of our games, you play the game, and then the doctor comes and sees your scores, and then you came in for a headache, but then realizes your A1C numbers are off, but also you're having some vision issues. And the doctor starts asking you questions about your food and realizes that the doctor, not our platform, but the doctor realizes like, I think you may have early onset diabetes. That
Mm,
blew them away. And I said, well, that's the power of our platform, is that to give insights to the doctor that they would otherwise never be able to see, because those aren't readily questions that they're going to play. They're not
yeah,
going to play 21 questions with you when they have 5 minutes with you. Right. So we're
right,
enhancing that. And she just yells across the room. She goes, stop, stop. Wait, hold on. You just blew my mind. Is that possible? I'm like, of course it's possible. And I was like, we're doing it right now. And then I showed them, and they were just so, excited. And then I let them do it. So I made them create a medical game document, make their own medical game using AI, very simple games. And I was
huh?
flabbergasted by the games that they created. They made personal games too, like games that affected them deeply. Like one of them had grandparents had Parkinson's, so they made a Parkinson game. One of them has a mental health issue. She put it out there, and it was. I was just telling this to another friend. I can't believe this generation just openly talks about
Wow,
their stuff, their
yeah.
personal stuff, whereas my generation would never talk about stuff like that. And I applaud that as fascinating, and I'm very impressed with them with that. So now we have a larger partnership with this university as we expand it to later on this year to a larger crowd at the university. So it's a
Mm,
successful thing. To answering your point is yes, like these kids, I call them kids, they're younger than us, but
mm,
these students are very empowered now. They're on
yeah,
TikTok all the time, listening maybe to some people that are actually doctors and maybe they're not, but they want more information. They're hungry. So when investors ask me about what about that generation, that's what I tell them. Like they want it. They need it.
they're already
Um,
there.
they're exactly. I mean, it's just a matter of time on that shift of more and more health education games out there, which we're pioneering.
Yeah, incredible. Um, and I think the aspect of the gap that you're filling, right, is actually is an unknown gap,
Hmm.
right? Because the doctor can diagnose based on what they have learned from the patient and along with what labs and other tests they've done. But you're the better doctor you can be is the more you know about the patient, and what
Hmm.
they're experiencing on a day-to-day basis, and
It's a great way to put it.
you're unlikely to find that out in a short consultation, right?
Mhm.
They'll ask the basic questions, but there's all those hidden insights now, and I call them hidden because they're probably even unknown insights, right?
Mhm.
Like you were just mentioning. And as we get to know more about the human body and physiology and um, uh, mindset shifts that happen within our, how our body reacts to our mental state
Yeah.
and so many other things, um, that there's something that can be completely unrelated, that actually is an early sign.
Mhm.
But if it's not talked about because it seems like it's completely out of context,
Exactly.
it's not going to be revealed.
Yeah. Yeah, that's how
And
I was
Mhm.
diagnosed with a rare disorder because
Oh,
it was my potassium levels had always been low and no one actually batted an eye about it until a nurse practitioner was like, put put more he got to know me and my medical history. I spent an hour with him in a doctor's visit, then a 5-minute visit with another, doctor and
wow.
they got me they got it. And I was like, "What? That's fascinating." And then he played my platform. He was really excited because I said, "Well, maybe this is how it ties it in." And so it was my pitch to him. But yeah, it's exactly to your point. It's just it reveals things that they may have never, the insights that they may have never thought of, considered, or put together because it wasn't available to them before. But now it is.
And I think that that's that level of that aha moment you heard from those students, right? And I think also this can come through from patients themselves, right? Is that aha moment of, no, actually, I don't go to my physician's consultation of surrender, right? I'm not
Mhm.
here and just going to surrender and wait for the doctor to ask me stuff. I'm actually going to engage with that dialogue, and through this care system that you're making accessible, is I'm going to learn deeper aspects of that. And I'm going to be encouraged to ask questions because not because someone's telling me to ask questions, but I'm going to think about things because I'm learning about all of these aspects of my condition that, oh, wait a minute, what about this? I'm curious about that. I'm curious about this. Maybe I should mention that.
Mhm.
And I think this is what, when I went to a MedTech conference, my first MedTech conference in 2017. And when I went to that conference, someone from Medtronic, a leader from Medtronic, was
Mm.
asked, "What do you think is the future of digital health?" That's how it was phrased at the time. And he said, "It makes the patient a better patient."
Mm.
And that just blew my mind. I brought that back and I shared with so many others with further context and things that I learned from the conference. But that always stuck with me, is that this enables us to go deeper into care than was ever available before. And now, with the advancement of tools and technology, it becomes so much more accessible. Not
Mhm.
only does it make the patient a better patient, because we're talking about adherence and those kind of educational tools there, but what you're also bringing forward from these insights that can be revealed, it makes the physician a better physician,
Yeah.
and
Yes.
they're also learning more about their patient.
Absolutely. Yeah.
So, Carlos, has been absolutely wonderful spending this time with you today. We could keep going on and talking for hours and
Yeah.
hours because we always do.
Yeah. Absolutely. Just another day of one of our hangouts.
Yeah, absolutely. But so happy to have you on this stage here today, Carlos. I think absolutely fascinating, and just remind again, what you're bringing forward is called Health Quest Gaming.
Mhm.
And we'll share in the show notes the website and other information so that people in the audience can go and learn more about it. So do make sure to check out the show notes here, and I'll also include, Carlos, your how to contact you and
Mhm.
directly, and other information you may want to share.
Absolutely. Thank you.
And yeah, so good luck, Carlos. Thank you so much for coming here today and sharing. I think it's absolutely fascinating. Really touched to hear from your origin story. This is where magic gets created, and you know, I think absolutely fascinating. I'm so excited to see where this is going to go because I think it's just going to keep going and get better and better, and I think it can make a real difference.
Thank you. And to you as well, because I think your podcast is doing the same thing, reaching. And I've always told you that it sounds really weird saying it out loud, but I'm really proud of what you've accomplished so
Aw.
far. And I've always thought of you as a mentor because you just know so much. And you also are just a good person. And it's rare to find someone who knows a lot and isn't a jerk. So, I appreciate you and I'm really happy to be on your podcast. It is an honor. Yeah, thank you so much and wishing you the best of luck on the podcast too.
Thank you, Carlos. And I'm also going to share information about how you got me started as being a guest on your podcast. So
Mhm.
I'll also share your the previous episodes in the show
Sure.
notes as well, because I think it'll be really helpful to people also. So thank you, Carlos.
Mhm.
Um, we will talk again
Yeah.
off stage. So
Okay.
take care. And as you advance, Carlos, want to share more with the audience, do come back. We'd love to have you.
Yeah, absolutely. Thank you.
All right, take care. Thanks so
All right.
much.
Bye.